If you're over 60 and you believe walking is the best thing you can do for your body, give me just 1 minute of your time. What I'm about to share might genuinely change the way you think about staying strong as you get older. Walking is good. Nobody is arguing against that. But if walking is the only thing you're doing for your body, there's a critical piece missing, and that piece is strength. Welcome back to the channel. This is a place for simple, practical guidance to help you stay strong, steady, and independent well into your 60s, 70s, and beyond. Today we're talking about something that affects almost every person over 60, whether they realize it or not. The real question: what decides how independent you'll stay? Let me ask you something honestly. When you get out of bed in the morning, do you feel stiff before you've even taken your first step? When you stand up from a low chair or a couch, do you find yourself pushing off with your hands just to get up? Do your legs feel weaker than they used to, even though you walk almost every single day? If any of that sounds familiar, you are not alone. Millions of people walk regularly and still deal with weak legs, shaky balance, and tired muscles. Here's why that happens. Walking is a forward, repetitive motion. It uses the same small set of muscles over and over in a limited range, and it barely touches the muscle loss that naturally happens as we age, something doctors call sarcopenia. After 60, your body loses muscle faster than it builds it back unless you actively work against that process. And muscle isn't just about looking toned. Muscle is what keeps your joints protected, your blood sugar stable, your bones supported, and your body capable of moving safely through daily life. Here's something that might surprise you. The biggest factor in whether you'll be living independently in your 70s and 80s isn't your weight, your cholesterol number, or even your daily step count. It's how strong your legs are, it's how steady your balance is, and it's how easily you can go from sitting to standing. That single movement, sitting down and standing back up, says more about your long-term health than almost anything else. The exercise that outperforms walking. So what is this one movement that does more for your body than walking alone? It's the chair squat, also called the sit-to-stand exercise. It sounds almost too simple to matter. Standing up from a chair and sitting back down, done with the right form, is one of the most valuable exercises available to anyone over 60. It activates your thighs, hips, glutes, core, and lower back all at once. The exact muscles you rely on for walking, climbing stairs, getting out of bed, carrying groceries, and most importantly, catching yourself if you start to fall. Walking tends to get easier the more you do it, because your body adapts and the effort plateaus. A chair squat, on the other hand, keeps challenging your muscles in a controlled, safe way that continues building real strength rather than just maintaining where you already are. Think about what happens every time you stand up from a seated position. You're lifting almost your entire body weight against gravity, using your own muscles to do it. That is genuine strength training happening in your living room. Walking only ever supports a fraction of your body weight at any moment because one foot is always touching the ground. That's exactly why someone can walk daily for years and still struggle to rise from a low chair without help. It's not a lack of effort, it's that walking alone never asks your muscles to do that specific kind of work. Is it safe? Yes, here's why. If you're thinking, this sounds intense for my knees, or I'm not sure my body can handle that, take a breath. The chair squat, done correctly, is considered one of the safest exercises for older adults. Physical therapists use this exact movement as a foundational tool for rehabilitation, fall prevention, and long-term mobility training. That's not a coincidence. It's because you control everything about it. You control how deep you go, how slow you move, and you always have the chair right there as a safety net. It meets your body exactly where it is today, not where it used to be 10 years ago. How to do a chair squat properly. Here's the step-by-step way to do this safely. Sit toward the edge of a sturdy chair, feet flat on the floor, about shoulder width apart. Keep your chest lifted, shoulders relaxed, and your eyes looking forward rather than down. Lean your upper body slightly forward from your hips. Just a small lean, not a big bend. Press firmly through your heels and slowly rise to standing. There's no rush here. Slow and controlled beats fast every time. Once you're standing, don't lock your knees. Just stand tall and steady. Then slowly bend your hips and knees and lower yourself back down with control until you lightly touch the seat of the chair. That's one repetition. If you need extra support in the beginning, rest your hands lightly on the armrests. As you get more comfortable and stronger, you can cross your arms over your chest instead. What the research actually shows. There's real data behind this. Studies on older adults have found that the number of sit-to-stand repetitions someone can complete in 30 seconds is strongly linked to how long they live, how often they fall, and how independently they're able to function. In other words, this single movement reflects your biological age more accurately than a lot of standard medical tests. But the benefits don't stop at your legs. When you do this movement regularly, your heart works harder, your circulation improves, oxygen delivery throughout your body increases, and your metabolism becomes more efficient. You end up with better endurance and better cardiovascular health than walking alone tends to provide. You're not just training one muscle group, you're training your entire system to work better together. The hidden chemical benefit. Here's something most people never hear about. When your muscles are challenged through resistance, like they are during a chair squat, your body releases signaling molecules sometimes called myokines. These molecules travel through your bloodstream and help reduce inflammation, improve how your body responds to insulin, support brain function, and may even help protect against certain chronic conditions. Walking produces some of this effect, but resistance-based movement, like standing up against your own body weight, triggers a noticeably stronger response. Balance and the fear of falling. Let's talk about something people rarely say out loud, the fear of falling. After 60, many people quietly start limiting their movement, not because they want to, but because they're afraid of losing their footing, afraid of not being able to get back up if they go down. That fear shrinks movement. Shrinking movement leads to more weakness. And more weakness, ironically, increases the actual risk of falling. It becomes a cycle that feeds itself. The chair squat interrupts that cycle in the safest way possible. You are literally practicing the skill of rising from a low position in a controlled environment with a chair right behind you for support the entire time. Every repetition builds not just strength, but confidence. And confidence is just as protective as muscle. Why? It's gentle on your joints. A lot of people worry that any kind of squatting movement will hurt their knees or hips. When done slowly and with control, the opposite tends to be true. Lowering yourself down gradually means your muscles absorb most of the load rather than your joints taking a hard impact. This is completely different from high-impact activities involving jumping or sudden twisting movements. You're building strength without shock to the joints, which is exactly what aging joints benefit from most. If your knees are sensitive, simply reduce how deep you lower yourself. If your lower back feels stiff, keep your chest tall and move even slower. If you've been inactive for a while, start with just 3 or 4 repetitions. There is no shame in starting small. How often should you do this? Start with whatever number feels manageable and safe. That might be 5 repetitions, it might be 10 or 15. The right number is the one where you feel your muscles working without any pain in your joints. Aim to do this once a day or at minimum 3 to 4 times a week. As you get stronger, you can increase your repetitions or slow the movement down even further to make it more challenging without adding any extra equipment. People in their 70s and 80s who could barely stand up without using both hands have, within a matter of weeks of practicing this consistently, gone on to stand smoothly, walk with more confidence, and feel noticeably younger in their own bodies. This isn't about becoming an athlete. This is about protecting your freedom to move through your own life, where walking still fits in. To be clear, walking absolutely still has a place. It's wonderful for your mental health, your circulation, and gentle cardiovascular conditioning. But if walking is the only tool in your routine, you're missing the piece that protects independence the most. And that piece is strength. Without strength, movement gets harder over time. Without strength, balance weakens. Without strength, independence slowly fades, even if you're still walking every day. That's exactly why this one simple movement matters so much alongside walking, not instead of it. A quick and necessary safety note. If you have severe joint pain, a recent surgery, or any serious medical condition, please talk to your doctor or a physical therapist before starting any new exercise, including this one. Your safety always comes first. Mild muscle fatigue after exercise is completely normal. Sharp pain is not, and you should never push through it. Progressing the movement over time. Once your body feels more comfortable with the basic version, you don't need weights or machines to make it harder. You simply slow down the lowering phase. Instead of sitting down at a normal pace, lower yourself over a slow count. 1, 2, 3, then stand back up. Another simple progression is pausing for 1 second just above the seat before sitting down fully. That brief pause forces your muscles to work harder to control your body. Small adjustments like these create meaningful improvements over time. Breathing matters too. Here's a detail that often gets overlooked. As you stand up, breathe out gently through your mouth. As you lower back down, breathe in through your nose. This breathing rhythm helps stabilize your core, support your spine, and keep your blood pressure more balanced throughout the movement. Making it a habit. The easiest way to make this stick is to attach it to something you already do every day. Try doing your chair squats right before breakfast while the kettle is boiling or during a commercial break on television. When an exercise becomes part of your existing routine instead of something extra to remember, it stops feeling like a chore. And once it stops feeling like a chore, it becomes permanent. The emotional side of strength. There's an emotional layer to this that doesn't get talked about enough. As people age, their world can quietly start to shrink. Certain activities start to feel too difficult. Certain places start to feel too far away. Without anyone noticing it happening, life gets smaller. Strength reverses that shrinking. When your body feels capable again, your mind tends to open back up along with it. You feel more willing to go out, to try new things, to stay connected with people. Physical strength and emotional strength are far more connected than most people realize. A word for anyone who feels discouraged. Maybe you've tried exercise before and it didn't stick. Maybe pain got in the way. Maybe life simply got busy or motivation faded. None of that disqualifies you from starting today. Your next step doesn't need to be big. It can be as simple as standing up from a chair 5 times today with attention and care. Progress doesn't usually come from dramatic action. It comes from small, quiet decisions repeated consistently over time. As you keep practicing this movement, you may notice small changes before you notice big ones. Feeling a little steadier on your feet, reaching for furniture less often, feeling a bit less tired by the end of the day. These small signs matter. They are the early proof that your body is responding and rebuilding. Bringing it all together. Your age doesn't define your strength. Your past doesn't limit what your body is still capable of. Given the right movement, done consistently with the right mindset, your body can keep adapting and growing stronger at 60, at 70, and well beyond. Walking nourishes your heart. Chair squats nourish your muscles and your bones. Together, they give you a complete, balanced approach to aging well, strong, steady, and on your own terms.